Oyibo man talk say knowledge is power. Yes. So if you won't get power on top any matter where you dey face at all, it good to make you understand, make you get educated on top the thing. That now why Health Corner dey here to give you all the better information you need to make your body day. Kajad. Yes, my name is Dr. Adora, and good morning. We don't yarn this matter we concern your peace and even a urinary tract infection. We don't talk about some of these symptoms where you go see, they make you they think say, it be like say you get more. So now, if you they suspect for your mind, say, you get this urinary tract infection, I beg, just waka, go meet your doctor. Not take and play at all. Your doctor will tell you, say, make you bring urine sample. You go piece inside one container. Then they go do tests to check whether this urinary tract infection bacteria where they cause them, they inside. Well, waiting be the major treatment. The major treatment now just antibiotics. But you know, if you just go any pharmacy, just let them say, give me any antibiotic, I want to treat this thing. No, you go wait, make your doctor prescribe the right antibiotic. That's not why they do tests. Because some kind of antibiotics then, now them they work for some specific bacteria them where they affect you. And then when they give you this antibiotic, I beg, make sure you complete them. If they say make you take them for 7 days, finish them. Even if you don't begin, they feel well. Then on top that one, they drink plenty water, because it will help flush the bacteria from your system. On top that one, your doctor said he prescribe some other medicine them to make sure say the pain commot, that pain where you feel when you piss. Then you get the one where they call chronic UTI, like they talk for the beginning of this thing. About 1 in 5 women, they experience another urinary tract infection after the first one where they experience. And some, the thing will continue for a very long time. And in most of these cases, the bacteria where they cause them, now different type, different strains. If not Escherichia coli cause them this first time, if it be staph where cause them the next time. But some of these types, then fit invade the body, they go just waka, enter inside your cells, come form one kind community where they, as in they come form or they she against any antibiotic, and even your immune system, anyhow the thing they work, the thing not go they, you not go they help them at all. Then some of them go come travel out of the cell, go enter again inside your body to come form one kind better ogbonge resistance against any antibiotic where you they take. All this one will make the bacteria they attack the women again and again. You get some women where their own now because of genetics, as in the thing like say they inside their blood, they inherit them. So because of that, they predisposed to this urinary tract infection. Anything where they do, they go get urinary tract infection. While others get some kind of abnormalities for the structure of their urinary tract. Onto say the way the thing form, you not form normally. So it go make them they very open to this infection. Some women we get diabetes, then they get very high risk of this urinary tract infection because their immune system, that now the soldiers where they fight infection for their body, don't they compromise, they don't they weak. So they know they get ability to fight off all these infections, including urinary tract infection. Other conditions where it make person get increased risk of this urinary tract infection. Now pregnancy, then anything where they affect the flow of urine, like a kidney stone, if person gets stroke, and if person don't get any spinal cord injury, all this one fit cause a continuous infection of this urinary tract. Then, as I talk, if you get more past like 3 or more urinary tract infections every year, your doctor will recommend one special treatment plan for you. And some of them, it go first send you, you get some kind of doctors where their own work now just to deal with this urinary system, they call them urologists. Yes, so these ones, they go prescribe some kind of things. Now, some of them will give you low dose of antibiotic where you go take over a very long period, as opposed to all those 7 days or 14 days, they will give you to take for a very long time to prevent this infection. Then some of them go tell you, they go recommend the one where you go take after you don't do touchlighting with your husband or something, because all these ones, like I talked before, now then fit trigger this urinary tract infection. So if you take antibiotics like 1 or 2 days every time before these symptoms disappear, then you get some kind at-home test kits where you feel use when these symptoms start again. And this test, they will help you, even without prescription, and it will help you determine whether you need to call your doctor or not. Then if you dey on antibiotics, you fit even do tests to see whether the thing they work and you don't dey cured of the infection, even though you still need to complete your medicine. Contact your doctor if the test dey positive or if your symptoms continue, whether or not the thing they give you negative results. I go bar break on top this matter. Tomorrow, I go send you how you fit prevent this urinary tract reinfection and how you fit make sure say this thing not carry in ugly leg come knock for your domot. My name is still Dr. Adora, and this now your health corner for On Top your Good Morning NAIJA show. Oga DH.